Howdy, folks. Ray Benson of the Sleepers Wheel right here. I'd like to wish the People's Community Clinic a happy 50th birthday. It just so happens to be Asleep at the Wheel's 50th birthday. We all started at the same time. And some of y'all might know, in 1974, I got the flu and went down to the People's Community Clinic. I was a broke musician and got treatment there. It was on Guadalupe Street, back by the university, if I'm not mistaken. And over the years, it's certainly grown into an incredible asset to the community. And we congratulate y'all on a 50th year of helping folks in Austin stay healthy and providing a service that nobody else can do as well as you. And congratulations on the new building and the new enterprises, which are so needed as Austin grows and into the future. Thank you, People's Community Clinic, for 50 years. And I remember in 1973 doing the first of many benefits with Willie Nelson and Asleep at the Wheel. Let's do it again.
Hello, I'm Evan Smith, CEO and co-founder of the Texas Tribune and longtime friend of People's Community Clinic. It's my great pleasure to welcome all of you to People's Community Clinic's annual There's No Such Thing as a Free Lunch event. This year, that title, There's No Such Thing as a Free Lunch, is especially true. There's no free lunch because, well, there's no lunch. While you might be missing the Four Seasons Ballroom, think of it this way. At least you won't get stuck in the valet line for 30 minutes after we're done today. Don't worry, that parking garage will still be there next year. I'm especially happy to be your MC because today we're celebrating a big milestone, 50 years of People's Community Clinic. I know many of you tuning in today are longtime supporters of People's Community Clinic, and today's celebration is as much about you as it is about staff and patients. People's has been championed by this community since its founding, and we wouldn't be here today without so many of you. But for those of you who are new to this incredible organization, I want to share briefly with you some of the specific reasons why Austin is so devoted to this clinic. People's Community Clinic is an Austin original. It was founded in 1970 as People's Free Clinic in the basement of the Congregational Church on the Drag by a handful of visionary volunteer doctors and nurses who saw that many UT students and people experiencing homelessness had nowhere to go for affordable care. This clinic is so important to Austin and Central Texas because Texas has the highest rate of uninsured people in the country. 1 in 5 Central Texans doesn't have health insurance. And you know that going without health insurance usually means going without health care. Today, Peoples still provides health care on a sliding scale. This year, Peoples expects to serve nearly 20,000 patients in our community, an enormous and astonishing impact made possible by those of you here today. Today, instead of a church basement, Peoples operates out of a beautiful 59,000 square foot clinic. And in addition to providing comprehensive health care for everyone, from newborns to non-agenarians, Peoples is committed to helping every patient they serve improve their health. For example, before the pandemic, Peoples hosted a mini farmers market to provide access to fresh, locally grown produce. My own doctor's office does not do that. Peoples also teaches nutrition and cooking classes to help patients with diabetes and hypertension manage their conditions by making healthy choices. They provide free exercise classes to help patients stay active, and free books to toddlers and preschoolers to boost their early literacy. And People's new medical legal partnership helps patients resolve health-harming issues like asthma exacerbated by poor housing conditions. All this good work has been recognized in a number of ways with awards and accolades, from being named a top workplace by the Austin American-Statesman to being named a health ecosystem hero by Dell Medical School. And last year, Peoples was the only clinic in Austin designated as a leader in LGBTQ healthcare equality, which means its facilities are dedicated to the highest quality care for LGBTQ patients. Peoples is one of only 6 facilities in the entire state of Texas that holds that title. For these reasons and so many more, we are here today to celebrate 50 years of People's Community Clinic. Now it's my honor to introduce one of my favorite people in Austin, the CEO of Peoples, Regina Rogoff. Regina has been Peoples' CEO since 2003, and in those 17 years, she's helped forge numerous partnerships, expand programs, and usher in a thriving new era for Peoples Community Clinic. Regina, I'll invite you to join me on screen.
Thank you, Evan, and thank all of you for being here today. The special celebration today is happening largely because of the work of our wonderful co-chairs. We have three marvelous women, Becky Beaver, Nona Nyland, and Marina Cifuentes. Thank you, ladies. It has been my privilege in my career to be part of this wonderful organization. We have been able to accomplish so much together over the last 50 years. Peoples Community Clinic is here because of your generosity, and your generosity means so much to the patients that we see, makes such a huge difference in their lives and in our work. So I just want to say thank you for your friendship, thank you for your charity, and thank you for being here today. Together we've succeeded over the past 50 years, and we'll do even better in the next 50. Happy birthday, Peoples Community Clinic. Thank you.
Peoples Community Clinic also wouldn't exist without the dedication and expertise of its board of directors led by Fred Blackman, the leadership of our foundation board members, and Peoples staff, beginning with our Chief Medical Officer, the amazing Dr. Louis Appel. We owe a deep debt of gratitude to the St. David's Foundation for providing sustaining support since 1996. And we thank the Michael and Susan Dell Foundation, Episcopal Health Foundation, and St. David's Medical Center for partnering with us to bring innovative programs to our patients. And a special thanks to Congressman Lloyd Doggett for introducing us to Congresswoman Donna Shalala. Let's take a moment to recognize today's big-hearted major sponsors who've helped make this celebration possible. They are Dr. Carolyn Oliver, Patient Always First Foundation, Sarah Buss, Ricky Rushing and Alan Gilmer, Rudd and Wisdom, and Tito's Handmade Vodka. Most importantly, we know that you are very busy and receive a lot of invitations to events like this one. We are so grateful to you for taking the time to be with us. This year is unique in many ways. 2020 marks Peoples' 50th anniversary providing affordable, accessible health care. That's 50 years of serving patients with dignity and respect. 50 years of healthy families, happy babies, and inclusive care. As a token of our appreciation, we wanted to share with you a gift that you have made possible for our clinic and our city. Recently, Peoples was named by the Health Resources and Services Administration as a Gold Tier Health Center Quality Leader, placing the clinic among the top 10% of all public health centers in the country. That's quite an accomplishment from the lead federal agency whose function is improving access to healthcare services for people who are uninsured, isolated, or medically vulnerable. You have helped give Austin one of the top health centers in the country. Thank you. On behalf of those whose lives the clinic has touched, thank you.
Hello, my name is Alejandro Escovedo, and I'd like to wish Peoples a happy 50th birthday. I know all too well how a sudden illness can be devastating and change your life, especially if you can't afford health care. Years ago, Peoples was there for me when I needed them, and I know they'll be there for you in times of need. So please help me in supporting and congratulating Peoples Community Clinic on 50 years. Thank you very much for all you've done for our community. Peace.
Thanks, Al. You're a Texas treasure, and it's always great to see you. I just wish we were together in person. 2020 marks 50 years of providing affordable, accessible health care to families in need with dignity and respect. Let's take a few moments to look back at 5 decades of caring for Austin.
Do you remember the guy that we found to run the lab for a while? And he was waiting for
Rob Abrams?
Yeah, Rob Abrams.
He was my vet for years.
Right, he was waiting for his licensure. He came from Illinois, I think.
Okay.
He needed a job, and we needed somebody to run the lab, and
Right.
marriage made in heaven.
Yeah.
But I remember we had a veterinarian as our lab director.
What I remember about the clinic is it was in the basement of a church. You went down the stairs into the clinic, and it was a large open room. It was a simple thing back then. It wasn't big at all.
There was a real emphasis in the 70s on people taking control of their lives. And I think a lot of the people who were there at the inception of People's Community Clinic, which started as People's Free Clinic, were very much committed to the idea that what they were doing was both empowering themselves to learn more about their bodies and to share that information with women throughout the community.
For me, People's Community Clinic provided a safe place to get good prenatal care, women's health care, which was not something that really existed back in the 70s. It was a rare and wonderful thing to have.
The staff at the time at People's Free Clinic were all amazingly driven to help others, which is why most of them were volunteers. They weren't being paid to do this.
And they came from all walks of life. You know, some had barely more money than the clients.
But what they shared in common was a deep-seated need to put themselves out there for others.
So moving into the 80s, we were confronted with new challenges. AIDS became a reality in our community. I think that People's was well situated to see people who maybe were not being seen in other mainstream organizations. The thing that I love about People's is that we're always looking for ways to meet the needs of the people that we were serving. And so back then, anonymous AIDS testing was not available. And so we started doing that at People's. And I think that was really important.
The struggle that we really saw a lot of was people with complex, multifaceted medical illnesses with no funding. Yeah, it was just a lot of doing whatever we could do. And it was just that very much, what can we do to get needs met? What can we do to get needs met? Because there wasn't, outside or bureaucratic or financial support for folks.
In spite of the very generous welcome that we always had at the Congregational Church, eventually we outgrew that space. And the folks started to look around for alternative space close to campus, and were able to acquire the building at 2909. And so that became the new home for People's Community Clinic.
I think it's important to remember that here at People's Community Clinic, we do the best that we can with the resources that we have available. There have been just numerous heartwarming stories, both for the clinic and me professionally, in patients that never really had contact with state-of-the-art medicine, and it's always just a joy for me to be able to provide them with services that they didn't think were available to them.
We were in tight quarters and had limited rooms, and everything was a little bit less efficient. The expansion into this new building was such a wonderful gift to all of us, both the staff who work here and the patients that we serve. Just beautiful spaces full of light that make patients feel welcome and that make it even more of a joy to work.
For me, it has been an honor just to have the opportunity to start a new department on a clinic like People's. Dental has become now a new portion or new part of that integration that People's trying to do. So People, I think, is ahead of the game.
With our pediatric departments, we are able to provide more patients care through additional providers. And our actual department and where we actually can see patients has also doubled in size. So really allowing us to see kids when they're sick and see the same day.
I'm most looking forward to people's future in our ability to be a voice for those without a voice. I see my work here and everyone who works here as people in the forefront of helping those who are in need, who are underinsured or uninsured, to provide the resources and the care that they deserve. And I see Peoples as leading the way in making a difference for those in need.
When you have no insurance and nowhere to run, and you know that you're going to need lots of medicines and lots of caring, and you don't have that guidance, it's just terrifying. The staff is amazing. They make you feel welcomed. They make you feel like you're a part of the clinic, you're a part of this, and they're there to support you.
Without People's Community Clinic, I don't think that I would be walking and talking and living life like I live life now. My life is better in so many ways because of People's Community Clinic.
Peoples is often a pioneer for change. With the growing population here in Austin, there is a need for high quality healthcare. I'm confident that Peoples is prepared to meet that need over the next decade.
We've come an amazing way from the basement of the Congregational Church in West Campus. All of that couldn't have happened without the support from all of the people who are here today to celebrate with us. So I just want to thank each and every one of you for helping make the 2020 People's Community Clinic so successful. Thank you.
Now we're going to hear from the medical leadership at Peoples for an update on how the clinic has stepped up to respond to this pandemic. Louis Appel is the Chief Medical Officer and Director of Pediatrics at People's Community Clinic and has been with Peoples for 20 years. Among his many accomplishments, Dr. Appel graduated from Harvard Medical School and while there obtained a Master's of Public Health. Joining him is Dr. Pritesh Gandhi, the clinic's Associate Chief Medical Officer. Dr. Gandhi has a medical degree from Tulane University and a master's degree in public health from Tufts.
Hi everyone, I'm Dr. Louis Appel. Thanks for being here. Before we talk about what's going on at the clinic today, I'd like to take a moment to recognize our staff. From nurses, medical assistants, providers, and social workers, to our facility staff, operations, ITIS, and development, to all our other departments. It's really been everybody at the clinic pitching in. These dedicated and compassionate individuals are on the front lines every day, making sure that many of our community's most vulnerable people can get health care during one of the worst public health crises of our lifetimes. We've had to drastically alter our processes and procedures, sometimes overnight, for patient intake and care. But our staff has been wonderfully adaptive, and I'm extremely proud of how they've handled all the challenges thrown their way. I'm going to turn it over to Dr. Gandhi now to talk a little bit about the changes that we've actually made in the clinic.
Dr. Appel, thank you for those words. And I'll tell you that this is a pivotal moment in the history of our clinic. As Dr. Appel mentioned, seemingly overnight, the clinic rallied to be able to change protocols and procedures and policies that would normally take years, if not longer, to put into place. And we did do it overnight because the need was there. Two of the biggest things that we were able to do was, one, push through drive-through clinics for COVID testing, and then number two, implement telemedicine services for our patients. Now let me take a second and just talk about both of these things. And what we were able to do was put staff outside in a way that made it easy for patients to come in quickly and get services quickly, and then get their test results on time. And so that drive-through clinic served hundreds of patients over the summer. At the peak of this virus in July and August, we were testing up to 20 or 30 patients a day. So we were really excited to be able to provide that service to our patients. Now, the second thing that we were able to do was develop a telemedicine program. At this moment, well over 60% of all of the encounters in adult medicine happen via telemedicine. I think that number is roughly around 50% for our system at large. We rapidly adopted a telemedicine platform. We shifted our protocols to be able to allow for telephone encounters, telephone office visits. and we are delivering clinical care via the phone to our most at-risk, vulnerable patients, and we've been able to do it well.
Well, you know, the pandemic has hit our patients in many ways. We've had an increasing number of patients who've lost jobs and told us they need help just putting food on the table, paying rent, paying for utilities, getting internet or laptops or tablets so their kids can attend school remotely, and other essential needs. After surveying patients several months ago, we've made efforts to connect those who need it with assistance and resources to help get them through this crisis. It's our mission to not only take care of their medical needs, but also to help make sure their overall well-being is cared for so they can stay healthy and thrive.
I think that's exactly right. You know, when I think about what it means to thrive, I think about the word resiliency. What does it mean to have resilient staff? What does it mean to build resilient families, to contribute to the tapestry of the neighborhoods that we serve? Since this pandemic started, like many other health centers, we took a hit in the number of patients that we were able to see and serve, particularly in March and April. But the clinic rallied, and we put these new policies and procedures in place. And I'm happy to say that just a couple of weeks ago, I think we saw something of perhaps 95% or 94% of the budgeted encounters that we had anticipated seeing when we worked through this at the beginning of the year. So we have been able to maintain access to clinical services, which is so critical. I think that what we've seen nationally and statewide is that vulnerable communities have had increasingly limited access to healthcare, to core healthcare services. And we've been able to, I think, maintain that pipeline of services for our patients. I think that's a testament to the resiliency of the staff right here on the ground that are so committed to taking care of the people that we serve. This has been a journey, and there's a lot more in store, so thank you.
And all of this work that we've been able to do, we can't do without the support of folks like you. You are what makes People's Community Clinic possible. So thank you. Thank you for your support and being here today.
Thank you, Dr. Appel. Thank you, Dr. Gandhi. You've heard the stories. You know that People's Community Clinic has a huge impact on real people here in Austin, especially now, in the midst of a global health crisis. We're very grateful to have with us today a longtime supporter and champion of healthcare, a true public servant who has been a state senator, the mayor of Austin, and is now dean of the University of Houston's Hobby School for Public Affairs, Kirk Watson. Senator Watson's commitment to the well-being of Central Texans has been tireless, specifically on projects like his 10 Goals in 10 Years, which helped initiate healthcare programs that care for Texas's most vulnerable populations. As a cancer survivor himself, Senator Watson knows very well the personal nature of healthcare, which is why he's so passionate about making sure that all Texans have access to quality, affordable healthcare. We're especially glad he hasn't forgotten us since his move to Houston. We're always happy to see him. Please welcome our friend, Kirk Watson.
Hey everybody, it's Kirk Watson, and I'm here with you virtually so that we can celebrate a tremendous anniversary, and that's the 50th anniversary of People's Community Clinic. You know, 50 years ago, People's got started because a group of volunteer nurses and doctors and others knew that their friends and neighbors in Central Texas and in Austin needed a medical home. So they created People's Community Clinic in a basement of a church just off Guadalupe near UT. And what they would do is they would, a couple of nights a week, they would gather and they would see patients. They would see people that needed this health care. Sometimes the line would be around the block, but they would do that until the last person, the last patient was cared for, sometimes till well after midnight. From very, very humble beginnings until today, where People's Community is an institution in Austin, Texas. It's a home, a medical home, to over 20,000 Central Texans. It got started because people wanted to make sure that they gave of themselves. They helped their neighbors who were in need. And 50 years later, there's still a need. In fact, it's probably an even greater need, in part because of why we're doing this virtually, because of COVID. So many of our neighbors have lost their jobs. They're in desperate need, and the truth of the matter is The disparities that we've seen arising out of COVID and the disparities that we have in healthcare, we're still seeing when it comes to providing that healthcare for people at People's Community Clinic. So here's what we need to do. The folks that come in, they're all living in poverty. They're our friends and our neighbors, but they're living in poverty. They're struggling through these times. And what happens is they give, they contribute, they pay as much as they can on a sliding scale. But the difference has to be made up. And that's where you and I come in. That's where we can be like those first volunteers who made People's what it is today. We can show our empathy, we can show our love by us contributing. So that's what I'm going to ask you to do right now. I know you're probably mesmerized by the sound of my voice. I know that I am most of the time. But here's what I'm asking you to do. Pause right now and click on that screen or send the text so that you can make the contribution. I'll wait. Have you done it? Come on, go ahead. There's never going to be a better time. Go ahead and click on the button or send the text and do the act that will help our neighbors who need the medical care this can provide. All right, I'm counting on you. People's Community Clinic is counting on you. People's Community Clinic, 50 years later. God bless People's. God bless all of y'all. Please stay safe, happy, and healthy.
Thank you, Senator Watson. Now it's my pleasure to introduce today's keynote speaker. The Honorable Donna Shalala served as U.S. Secretary of Health and Human Services under President Bill Clinton, where she created, implemented, and oversaw the Children's Health Insurance Program, which will provide health care coverage to more than 7.6 million children this year. Secretary Shalala also served in the administrations of Presidents Jimmy Carter and George W. Bush. She's a member of the Council on Foreign Relations and has been elected to 7 national academies, including the National Academy of Medicine, the American Academy of Arts and Sciences, and the National Academy of Education. In 2008, President George W. Bush awarded her the Presidential Medal of Freedom, the nation's highest civilian award. Secretary Shalala has been named one of America's best leaders by U.S. News and World Report. She's the recipient of the Nelson Mandela Award for Health and Human Rights and was inducted into the National Women's Hall of Fame. Since 2019, she's served as the U.S. Representative for Florida's 27th Congressional District. Please join me in welcoming Congresswoman Donna Shalala.
I'm delighted to be with you. I wish I was in Austin.
Well, we wish we had you here in Austin as well. Maybe sometime in the future we'll get you back. Thank you so much for joining us. It's a very busy time. We're heading into month 7, Congresswoman, in this country of sheltering in place because of a once-in-a-century public health emergency. We happen to have with us a former U.S. Secretary of Health and Human Services. You have a unique perspective on the virus. In your view, tell us, how did we get here? And what have we done right and what have we done wrong? And where is all this heading?
Boy, I wish I knew the answer to all those questions, but let me say this. We got where we are today through inept leadership from the national government. They should have taken hold from the beginning. And in fact, I have a bill with Representative Jamie Raskin that laid out what the role of the federal government is. Here's that role. Clear, consistent messages from the public health officials that filter all the way down. Masks, for example, a consistent message about masks, about social distancing, and about sanitation. Second, they should have immediately taken advantage of the Defense Procurement Act to produce PPE, protective equipment, for every hospital, for every essential worker in this country, for every nursing home. The only way we were going to get the volume that we needed was to use the Defense Procurement Act. The president controls that. And number 3, we needed everybody to get on the same page so that this president simply delegated it to the states, to the governors. Right. We needed immediate information, and we needed to keep the credibility of the great scientific institutions, the FDA, the CDC, the National Institutes of Health.
Yeah, you've teed up a lot I want to ask you about, and I'm going to come to the question of the states and the feds. I'm going to come to the CDC in a second, but I want to ask you, sort of stepping back from this, Congresswoman, what the virus has done to our healthcare system, right? So right now we know that the healthcare system in this country is strained. Healthcare providers are strained. We will come out of this at some point. My question to you is, what kind of a healthcare system are we going to have when we come out of this?
We're going to know about the disparities in the healthcare system. We're going to know that our current economic stimulus for healthcare, and that is to make it so efficient that it can't expand quickly, is probably the wrong way to go. We need more redundancy in the system and more nimbleness. And stronger public health people at the state level working with the healthcare system. But we need to close the gap between those that have good health insurance and those that don't. And states like Texas and my own state of Florida that have not expanded Medicaid, we're going to have to find a way to do that. We cannot have one person in this country that doesn't have good health insurance, because the strain on the healthcare system is not only their ability to deliver health care, but it also is an economic strain.
I know we're not having a political conversation today, Congresswoman, but when you call out Texas and Florida as two examples, we have to point out that the only way for a change in policy on expanding Medicaid to happen is for people at home in Texas and Florida to take responsibility for putting people in office who are willing to entertain that conversation. Isn't that right?
Yes, but it takes a big coalition. The business community, the health community, they shouldn't be shy about stepping forward and talking about the health implications of not having coverage, but also the multi-billion-dollar economic implications about not taking their federal tax money back and investing it in their healthcare system.
Right. Ultimately, if you don't take that money in the form of Medicaid expansion, you're financing healthcare in other states, aren't you?
Exactly.
Yeah. So you mentioned the states, and I want to ask you about the tension between the states and the federal government in terms of how the response to the virus has played out. Do you think governors bear some responsibility across the country for how at the local level we've seen a response or a lack of response? And this idea of putting politics over science, again, at the state level, do you think governors bear a responsibility alongside the federal government?
They certainly do. Many governors, including yours and mine, have confused local government officials because they've changed their minds so much, not necessarily based on science. So, of course, governors bear a responsibility, but it's the federal government that should have insisted the states have a plan, bring the plan to the federal government, have the great public health experts review the plan, make sure there's enough redundancy built in and enough flexibility. And then we would have funded those plans and we could have measured their execution. Instead, it's every person for themselves competing against each other. And it's been chaos and chaotic, and it's resulted in unnecessary deaths, in my judgment.
Of course, the flip side, Congresswoman, is that, this concept of local control is a tradition in this country. The old Jeffersonian notion that the best government is the government closest to those being governed, and that there's no one answer for all 50 states. There's not a cookie cutter approach. Isn't it better to allow local officials, and that would include in this case governors, to take responsibility for crafting plans that are their own plans? Wasn't the federal government right to turf this to 50 governors?
Not necessarily. And let me make this very clear. Each state would have had a slightly different plan that fit with their area. A heavily rural state would have come in with a different plan than a heavily urban state. Most of our states are combinations of the two.
Right.
The only review of that plan is whether it meets health standards, not whether the delivery system, the execution system, varies from state to state. But let me say this about state control. We may have this tradition of local control, but you ask your mayors whether there's local control left in Texas, because the governors are usurping the local governments now. We have chaos between them because the local mayors have in many cases been far more responsive and stayed closer to the science than the governors have. So The system of federalism that we have has not worked correctly because we have not used the national government for what it does best, the state governments for what they do best, and the local governments for what their skill set is.
Right. Local control becomes at the local level controlling the locals, right? It's sort of it's the inverse of the original plan. You mentioned the CDC and some of the federal health agencies, Congresswoman. Let me ask you about that. And again, you are a former HHS secretary, so you have a perspective different from most people on this. Have we lost control of the CDC? Have we lost control of the federal agencies charged with dealing with the byproducts of a crisis like this? And do you still have confidence in those agencies?
I have confidence in the people in those agencies. These are world-class scientists that are revered around the world for their scientific expertise, and we have deliberately undercut their credibility, not simply with people around the world, but with people in our own country. That is just dangerous, and it's resulted in unnecessary deaths. So I am deeply distressed. I've spent a lot of time in government. I know about political interference in agencies. I spent a lot of time in government saying, just keeping the politics away and protecting the scientists. I never had a press conference in which I talked about the science. And Tony Fauci will tell you that I made him and the head of CDC and the Surgeon General of the United States and the head of the FDA put on their white coats when they talked about science. Because people trust the docs in their white coats talking about science. It was the Shalala rule. And the Shalala rule was the politicians didn't talk about the science, the scientists talked about the science, and they stood up there together in their white coats.
You mentioned Dr. Fauci. You know, there is a distinction between the institutions at the federal level, the agencies themselves, and then the individual leaders or scientists. Dr. Fauci is a great example of this because I think Dr. Fauci's approval rating out in the public probably exceeds that of almost any politician, right? People believe in the goodness of Dr. Fauci's intentions and the quality of his work. You had a relationship with him, did you not, back in the day? You called him out a moment ago. Talk about that. Talk about what you think about him and the job he's done and the kind of person he is.
Well, I worked with Tony Fauci during the last great pandemic, the AIDS crisis.
Right.
And Tony Fauci is an extraordinary human being. I mean, he exudes integrity.
Yeah.
He knows how to explain things and how to talk. He's a world-class scientist himself, deeply respected, but it's his humanity that comes through, his understanding of people's lives. I'll tell you a story about Tony Fauci. My second day in office, he called me and said, and I had sat on the director's council of the National Institutes of Health, so I actually knew him years before. He called me and he said, I'd like to bring by some kids. And it turned out they were kids that had been infected through blood transfusions. They were hemophiliacs. They all came with pictures of themselves and their families hoping that we would find a cure. Every single one of them would die during the course of that year. Wow. And Tony brought them up to really put a human face on what we were facing with AIDS and how we had to work like heck. First to find a vaccine, but eventually we didn't find a vaccine, but we found a treatment to save lives. I promised those kids that I would keep their pictures up until we found a way to save lives. And I kept my commitment to them. And most of them were not around when we finally found that treatment. Yeah. That's Tony Fauci. Right. That's Tony Fauci explaining to a policymaker what the real meaning of his and his colleagues' work is.
Right. Now, I've been told, Congresswoman, that you have a dog named Fauci. Is this true?
Yeah. My dog died a couple of years ago, and I was looking for another dog, but I've always had these big dogs, and I can only travel back and forth with a small dog. So I said to the rescue group that I work with in my district, I said, look, if you find a small dog, give me a call. So they called me one day 2 months ago and said that they had been fostering this little dog, and he was quite cute. He had run into an Italian restaurant. He had been running around Coconut Grove for a couple of months. They finally caught him when he ran into this Italian restaurant and come see him. And I did, and I just fell in love, and you'll see in a minute. And they said, well, you have to give him an Italian name. And I said, well, the only famous Italian I know is Tony Fauci. So let me show you.
Do you have the dog with you? You're kidding me. Look at that. The best guest appearance I've ever seen. Look at that dog. That dog is adorable.
Yes, he knows it too.
Does the dog have a little raspy voice like Tony Fauci?
No, he has a sharp bark.
Okay.
So he's got Tony's tenaciousness, but and he cuddles.
Well, I suspect I'm less interested in whether the actual Dr. Fauci cuddles. I will say that the actual Dr. Fauci probably has a tenaciousness that it would be tough for that dog to match.
Yes.
Congresswoman, back to Texas for a second. Here in Texas, we have accelerated and worsened a particular strain on our healthcare system, at least, and that's the crisis of rural healthcare. Of course, there were rural parts of Florida as well, but in Texas, we have had more rural hospitals close over the last 10 years than any other state. And even though the rural counties in Texas have had a lower incidence in most instances, not every, of the coronavirus, nonetheless, it has exacerbated what was already a pretty significant problem. What do we do about the rural healthcare crisis in this country as it relates to the virus and beyond?
Well, it's beyond, because we've been struggling with rural healthcare for a long time. The fact is, you're not going to have rural areas unless you have healthcare there. And while telemedicine has helped around the edges, it doesn't solve the problem. I have always believed that scarcity and density require extra resources. That was my philosophy in distributing healthcare money, that we have a good reason to subsidize rural healthcare because that's where people live. During campaigns, people always focus on the candidates. I've never thought campaigns were about the candidates. I thought it was about people's lives. Yeah. And if you understand people's lives, I have relatives, my sister and brother-in-law and my nephew and nieces that live in rural America, in North Dakota, in Minnesota, in Iowa. Getting health care, good quality health care, requires extra resources, and we just have to face that in the United States. And while one of the good breakthroughs has been telemedicine, because even the specialties have learned how to use it, it is not a substitute for having a presence, some presence, whether it's a hospital or a clinic, or a way to get to a regional hospital if necessary. There's just no substitute for that. And we have to rethink our networks state by state.
Well, and of course, you can't have telemedicine without Congresswoman. I mean, the broadband access problem in this country is disabling telemedicine as an alternative in a lot of rural communities, is it not?
Yes, and the FCC has actually focused on rural healthcare in particular, most recently with a pretty good product. But at the end of the day, you have to have someone that receives it at that end. The FCC could do a lot more. The broadband issue is rural, but 3 times as difficult in urban areas for kids. The number of families that don't have access to the internet, kids learning at home. So both in healthcare and education, we just need, and by the way, this is bipartisan. This is not partisan at all. This is something that we ought to have done before, and all of us in Congress are very conscious of it. And the CARES Act had the first investment. This new HEROES Act has the second investment in rural healthcare, in broadband for both healthcare and education.
Congresswoman, we have a Supreme Court case, Texas versus the United States, coming before some number of justices on the high court, 8 or 9, don't know yet, right? The week after the election. This is the attempt by the administration and its supporters to throw out the Affordable Care Act. What do you think the consequences would be if that actually comes to pass, if the Affordable Care Act was undone? As a result of this?
It's not just for those that get their health care through the exchanges. I have the largest enrollment in the Affordable Care Act of any congressional district in the country. I've got more than 100,000 people in my district. But it's pre-existing conditions for everybody, even those in private health insurance. It's parents who cover their kids up to 26. We forget about the other parts of the Affordable Care Act that affect all of us. And you cannot solve it with an executive order in which companies can charge anything they want if you have a pre-existing condition. Add to that everybody that has had COVID now has a pre-existing condition.
Right.
So we have millions of people who have a pre-existing condition now because they've had COVID. And there's no substitute.
One or two more questions, Congresswoman. We've seen you alluded to the public schools and the challenges that just getting kids back to school present in the context of the reopening conversation. We have seen cases spike back up in a number of states, attributable in part, it's assumed, to the return of students to college campuses and classrooms. You happen to have led a number of significant higher ed institutions, right? Hunter College and the University of Wisconsin-Madison, University of Miami. Can you speak about this particular aspect of the conversation, the return of college kids to campuses, and what that has done to the progress of this virus?
Well, colleges are about crowds, whether it's going to a football game or getting together after class or in class itself or hanging out. So reprogramming college students is very, very difficult. We did get them to wash their hands during H1N1. We actually got some discipline out of students during H1N1. But now we're saying to them, social distance, which is the opposite of why they went to college in the first place. So it's been, most schools have either gone online or had a hybrid online, but colleges are struggling with convincing young people that they're not invincible.
Yep.
I mean, we've been doing that for years without COVID-19. Right. And that they have to be disciplined about protecting themselves. And most colleges don't have the resources except for their football teams. We're spending resources on our football teams. And look, I love college football, but if you look at what we're doing for the football teams, if we did that for every college in America, first of all, it would cost us a fortune, but we would be able to protect all our college students.
Last question before we go, Congresswoman, and again, it's been so great to have this much time with you. Thank you so much. I don't want to forget the fact, or I don't want to forget to bring up with you the fact that we are talking today as part of an event celebrating the 50th anniversary of the founding of People's Community Clinic, that we're talking as part of a fundraiser for a community health clinic. Can you talk about the importance of community health clinics, places like People's Community Clinic, in communities like Austin, in communities like the ones that you represent? How this is part of the fabric of healthcare in this country?
You know, I actually visited the community, your People's Health Clinic many years ago with my friend Molly Ivins. And I believe deeply in accessible healthcare. And it doesn't have to be insurance. We think too much about insurance because we're so tied to the corporate way of our fragmented healthcare system, as opposed to convenient places that are accessible, that don't care what color you are or what your background is or whether you have good insurance or not, and providing health care to a population. And many of the people that go to community health centers have insurance, but they don't have access to health care. Right. So, and many have no insurance at all. So I am deeply devoted to our nonprofit community health centers around the country. And I'm delighted to make a pitch to everyone that this is an important part of the humanity of our communities and of civic leadership, because we have a responsibility to everyone, no matter their background, whether they're rich or poor, to have access to high quality health care. And I couldn't be more delighted to have done this with you, but more importantly, to make a pitch to the community in Austin to support the People's Community Clinic. There's nothing more important to express our humanity than taking care of everyone in our community and making sure they have access to high quality health care. So congratulations, and everybody out there, continue your support.
Congresswoman Shalala, what a perfect place to end this conversation. It has been really a treat for me and for all of us to have you join us. Thank you so much. Good luck with your hard work. Please stay safe.
Thank you very much.
Thanks once again for Congresswoman Shalala for taking time to be with us today. And now we have another special guest, Austin's sweetheart, Texas-born, Louisiana-raised singer-songwriter Marcia Ball stopped in to say hello.
Hi, I'm Marcia Ball. I'm a longtime friend of People's Community Clinic, and I'd like to say a few words about them. People's has been a medical home for folks without insurance since 1970. They serve those of us who work in the bars and restaurants, who drive cabs, who care for our children. The clinic provides care for musicians in the bands, for the people who run the sound and load in the equipment. They provide care for all those good people who work hard and don't make a lot of money. People's was taking care of many of my friends when I first came to Austin, and they still do. That's why I'm asking you to join me in supporting People's Clinic with a generous 50th birthday present. Happy birthday, People's Community Clinic. You keep Austin rocking.
Thank you, everybody, for tuning in today and for your generosity. If you haven't yet had a chance, please make your gift now. I can see that your gifts are still coming in, but right now we've raised well over $500,000, making this 50th anniversary event the single most successful event in the history of People's. I promise you People's Community Clinic will put your investment to great use for so many of our friends and neighbors who would not have health care without us. That's it for me today, and it's been great to be here. But that's not the end of our program. Sarah Bird is an Austin-based journalist, screenwriter, and novelist, and one of my favorite people in this city, in this state. As a young woman just beginning her career, she sought care at People's and became a lifelong friend of this clinic. Please welcome Sarah Bird.
Bonjour, je suis Sarah Bird, and my love for People's Community Clinic is so far beyond the power of words to express that I'm going to mime it for you. Beaver style. Yeah. Okay, so there I was. It was mid-1970s, just out of graduate school, trying to survive as a freelance writer with way too much emphasis on the free. No money, no insurance, and I got sick. So I went to People's Community Clinic, and they took care of me with respect and compassion, exactly the way they have been taking care of the Austinites who most need them for 50 years. What? 50 years? Come on! I'm going to ask you now to reach down, give a gift as large as you possibly can, and maybe even un petit peu larger. Because what the heck? You're not spending it on airline tickets, are you? Hey, I promise that your gift will make a difference. You might change the life of Austin's next Grammy award-winning artist, or just some random struggling writer, or who knows, perhaps a sad mind who is trapped in the prison of her own dreams. Okay. Thank you all very much, and I hope to see you on the donation list.